Hi there, I'm Jen Redfern from Plus Health Company. Thank you for watching. I'm a chartered physiotherapist and Plus Pilates teacher. And as a part of our training, we talk about muscles and wanting muscles to be both strong and have good endurance, but also to be lengthened and flexible. And sometimes we find that the muscles become out of balance. So it's almost like one part of the body is working harder than another, and that may lead to overcompensation, overworking, and then tension unnecessarily being held in our various body parts. Sometimes that becomes symptomatic, and it may be that actually you develop a preference in the way in which you're moving over the course of time, which suits you quite well, until one day your body's had enough, starts to get a bit fed up, and then may present with pain and discomfort. And so when we're looking at people in our physio clinic, we take a really detailed history and think about what may have led to that point of you coming and presenting in front of us. So when it comes to muscle slings and Vleeming's muscle slings, which is what I'd like to chat with you about today, we're looking at the way in which various muscles work with one another, alongside one another, to help to create and restore balance within your body. And Andre Vleeming was somebody who was really a pioneer way back when, and he really started to explore this concept of muscles not working in isolation, but in fact in pairs and groups. And this is where we come from in our thinking at Plus Health Company. And we've actually progressed beyond that now, but Vleeming was the place that we started. So, in a nutshell, our primary sling refers to four muscles. Our diaphragm is our main breathing muscle, and that sits up just under the rib cage. Our pelvic floor muscles form the basin, so we almost have a lid and a basin, and then we have a deep abdominal layer called transversus abdominis, and then if we just spin Ralph around for a moment, there's multifidus that sits deep along the back aspect of the vertebrae, so your vertebrae are your spine. Now those muscles provide very localized support, segmental support to your spine, and that is often what we refer to as core stability. So it's not about having a six-pack. It's about having deeper levels of control. We're a bit like onions, and we have layers rather than just one layer that we can see and feel. And that's really important in our starting point when we're thinking about our Plus Pilates classes. But then we need to consider other muscle slings. So there is one known as the anterior oblique sling, and that incorporates one of your oblique tummy muscles and the opposite adductor muscle group. They're the ones that bring the leg towards the body as opposed to taking them away, and an opposite tummy muscle. You have two obliques, so they both have opposing roles, and so you have one strand from one side and another from the other side working with the adductors, and that provides stability and control around the front of the pelvis in a fairly diagonal way. You also have a muscle group known as the posterior oblique sling. So if we spin Ralph around again, it's essentially the same kind of diagonal line, like braces crossing your back. But this time we're looking at your latissimus dorsi, so a large muscle that sits across the back of your rib cage and shoulder area, and then comes through and crosses through something called your thoracolumbar fascia and into your opposite buttock muscle, gluteus maximus. So that creates support similarly to anterior oblique sling, but around the back aspect of the body, and you of course have them on both sides. Now, whilst Ralph's got his back to us, let's talk about the deep longitudinal sling. So effectively that starts around the foot, and it's all the tissue that sits along the back of the leg all the way through the buttock towards the lower back, and that's known as the stability sling that's active when your heel is on the ground. So whenever it is, you will be creating some work around here. Now, one of the parts of this deep longitudinal sling is called your sacrotuberous ligament. It's a little ligament that goes from your sacrum to that knobbly bone that you can feel when you sit on your buttock, and that's got a stabilising role as well. So it's not always just muscles, sometimes it's fascial tissue and sometimes it's ligaments, and they all work to help to create stability and control in the body. Now we also have what we call the lateral sling, and the lateral sling is where we're looking at the muscles around the buttock, but different buttock muscles now. Buttock muscles like gluteus medius, you may have heard of that muscle. working with the inner thigh muscles, so the adductors again, to create sideways stability and support around your pelvis and control. So we've talked about the primary sling, the anterior oblique sling, the posterior oblique sling, the deep longitudinal sling, and also the lateral sling. And it's just worth having a little think about how you may feel in your body, and if you've got a pre-existing problem that you can date back to some kind of trauma or injury or period of time where things were different for you in your movement, then it may be that actually that shines a light on where you might need to focus to overcome the problem that you're having. So hopefully that's been useful. If it has, then you might like to check out our tutorial on anatomy trains, which extends our understanding beyond Fleming's muscle slings. So thanks for listening. Until next time, bye for now.